IM and subcut. Let's make it fast. Again, so you are giving a medication in this station. Make sure to check the prescription. You have to identify the patient. There are a couple of people who failed the examination because of not checking the prescription. You have to say what medication you're giving. Okay? Make sure to assess the injection site. There are a couple of people who failed the examination because of not assessing the injection site. Remember, you cannot give the IM on this, say, on this arm if this arm is infected. Okay? So it's important. It's one of the criteria wherein you can easily miss it. Okay? So make sure to assess the injection site. Probably you have to say that there is no sign of infection, surgery, etc. Like what you normally do on your blood pressure when you're doing it. And of course, scooping method. Do not ever attempt to resheath the needle using your hands, okay? There is a number of examinees who failed because of that. I know you're very much tempted putting the cap back, okay? Scooping method. We all know this, yeah? We all know this. But again, because of stress on the examination, you tend to forget this, okay? And of course, correct technique. Let's recap, guys. IM, is it stretch or pinch? Stretch, well done. So IM, it's stretch, we stretch the skin, and then for subcutaneous injection, we pinch the skin. Okay, so once you know that what skill you're going to do, you have to identify the proper technique. And believe me, there are a lot of people who's failing the exam because of wrong technique. And of course, you have to dispose your equipment accordingly. Where are you going to discard your apron and gloves? Of course, in the yellow bin. Okay, and of course, do not forget your sharps container. The needle should go to the sharps container. And of course, for IM, we treat the ampule as glass. So the glass ampule should go to the sharps bin after giving the medication. Remember that, yep? We're nearly done, promise. VIP, for the VIP and IV flush, again, check the prescription. There is a number of people who's not checking the prescription properly. You have to identify your patient properly. You have to identify that the prescription is correct in due time and that you have the proper medication. Yeah. There are a couple of fails on the examination. They're trying to remove the cannula. Okay. Remember on the exam, have you all seen a posi flush before or a pre-filled syringe? Yeah, you've seen one before. There's no needle. You only need to screw that on the cannula. There are a couple of candidates in the examination who attempted to remove the actual cannula. On the examination, you are not removing anything. You are just simply connecting or screwing the posi flash to the patient's cannula. Just put it there. It's like male and female on the examination. Of course, you have to give the required amount of medication. Surprisingly, the assessor will check your syringe. There are like a couple of candidates who only administered 8 mils or 6 mils. Sometimes on the examination, you're required to administer 10 mils. Make sure to administer the correct amount of your medication or normal saline, because again, it will cause to fail. I remember one of the feedback that we had, the assessor actually checked the posi flush from the bin. The assessor took the posi flush from the bin, showed to the camera, and they found out that only 6 mils was given. So you have to give the appropriate or what's written in the prescription. Again, proper technique, pulsating technique, and of course, dispose the equipment appropriately. NG insertion, common fails for NG insertion. You tend to forget the pre-procedure checks, the instruction, the raising of your hand, the checking of which nostril to insert the NG. Another one is incorrect precision. On the examination, of course, you're inserting it to a mannequin. Do not forget to tell the examiner that you have to position the patient in what position? To a sitting position. You have to say it or else you will fail. Even if the mannequin is already upright, you have to say it. We had a couple of candidates who did not say it and they failed. And of course, incorrect measurement. You know by now how to check the NG, yeah? Tip of the nose, earlobe, and of course the sternum. If you're adding 10 or additional 10 or 5 centimeters, it doesn't matter. You will still pass the examination, whether or not to add it. And of course, before commencing the feed, you have to say the checks. Normally, you have to check, of course, the pH, the length of the tube, and of course, if you cannot aspirate, you might need to escalate to the doctor's good request for an X-ray. It's written on your marking criteria. And of course, and another one is, of course, you have to state at some point on your pre-procedure, make sure that an oxygen is available in a suction device. It's written there. I think it's criteria number 9. I'm just thinking of a random number. But it's there somewhere. Yeah. Next is, we're nearly done, promise. ANTT and wound assessment. Normal common fail for ANTT, of course. Number 1, for wound assessment, you have to follow the marking criteria. You have to say whatever is written on the marking criteria. Yeah? I don't know if you've seen the marking criteria for wound assessment. You have to say, the floor of the wound, the closure of the suture, any presence of infection. You have to say all those to pass it. And of course, make sure to maintain aseptic technique. If at some point you violated or you break the asepsis on the examination, you have to state it. If you committed any mistake on the examination, you have to state it, because if not, it might result to a fail. Normally, let's say, oh, assessor, I made a mistake. My field is no longer sterile. Normally, the assessor will tell you, what will you do in real practice? Or what would you do in practice? Remember, you are a lone practitioner when you're doing the skill. Normally, of course, you just have to say to replace it over again and start over again. But of course, on the examination, you cannot do it because you will run out of time. Normally, they will just tell you to continue, but you have to say it that you did not maintain asepsis on the examination. And of course, know when to wash your hands. Again, you don't need to wash your hand 1,000 times on aseptic on ANTT. Normally, the rule of thumb is, before touching anything sterile, remember the 5 moments of hand hygiene, you wash your hands. Okay? Probably we cannot deny the fact that you will be washing your hands a lot of times on this station. But then again, try to think, is washing my hands necessary? Okay? Is washing my hand necessary? Again, we don't want you to fail because of running out of time. And probably one of my tip on the examination, when you're about to don your sterile gloves, do not put loads of hand gel because your hands will be sticky. Remember, in the examination, you're like this. You're nervous. Your hands are sweating, and you're putting your sterile gloves. You will not be able to do it. And the problem is, you might break the gloves. Okay? So again, my tip, do not put a lot of gel when you're about to don your sterile gloves. Hopefully that is helpful. Next, CSU and RUC. Normally, these are relatively easy skills. Normal cause of fail for CSU is forgetting to remove the clamp. Guys, do not forget to remove the clamp. Do not forget to unclamp, okay? First, we need to put the clamp before, and after collecting the urine, unclamp, okay? There are a couple of people who failed the examination because of not removing the clamp. Aspirating from the wrong port. Remember, we all seen a catheter, right? There is a port intended for urine collection. There's another port intended for the balloon. Do not aspirate from the balloon. Okay? I know back home in the Philippines, it's self-sealing, right? In the UK, it's different. There is a port intended for urine collection. You cannot just poke the catheter wherever you want. There is a collection port, yeah, intended for urine. And of course, not for removal of catheter, not giving the appropriate health education before and after. So what are those? Normally, the expected outcomes after removing the catheter. Remember, irritation, frequent urination, if you can still remember it. And of course, after, how many mils of water your patient needs to take? Let me know. What is it? Is it 2,000? 3,000? 2.5, yeah. Well done, well done. Do not forget to tell the patient to exercise and mobilize. Next, not following the correct reading time. Again, you need a total of 2 minutes to read the urinalysis. There is an intended time. Remember, guys, 30 seconds, we're reading the glucose. Of course, remember, the color of the urinalysis keeps changing over time. That is why, on the manufacturer's instruction, you have to read each criteria or each element according to the timestamp. Okay? So it means glucose after 30 seconds. After 40 seconds, what are we reading? Already written on the box of the urinary. Wrong interpretation. my tip on the examination, it's rare that you will find a normal urinalysis. Okay? Remember this. It's rare on the examination that you will find a normal urinalysis. They should be something wrong on the urinalysis. And of course, you have to give the correct health education according to the result. Okay? So you really need to practice your urinalysis. And we're nearly done. I think we're last 3 slides. For BLS, the tendency, you tend to forget to call for help. Yeah, I don't know if whenever you practice, sometimes you forget to call for help. Do not ever forget to call for help because no one will help you until you call for help. Yeah. And of course, wrong hand placement, wrong depth and rate of compression. According to our candidates, sometimes the assessor will tell you if your placement is wrong. So you have to listen. You need to keep practicing. You have to listen with your assessor. Normally, you will hear a clicking sound. Yeah. During practice, remember when you're practicing your BLS, you normally hear a clicking sound. That means you're doing it properly. If you don't hear the clicking sound, but sometimes it depends on the mannequin. If you have like to say newer mannequins or older mannequins, sometimes you don't hear the clicking sound. Yeah. So make sure to practice your in-hospital recitation. Emer, do we need to hand over at the end of BLS? No need. On the marking criteria, you are not required to hand over. But what they're asking at the end of the BLS is to explain. You don't need to talk while you're doing the actual BLS. Yeah? You don't need to talk when you're doing the actual BLS. Because in reality, we don't talk. Let's say, I'm about to do my compression. You don't have to say it, okay? Just do it, believe me, okay? You don't have to talk while you're doing your BLS because again, in reality, we don't do that. That's why at the end of your station, they will ask you, can you please talk through me or explain what you did? That is the time you will be telling the assessor, I checked for the scene is safe, etc. I did my compression, 30:2, the rate of 100 to 120 cycles per compression per minute. Yeah? Are we all following? There you go. Again, the assessor will tell you that instruction before you start. Okay? The assessor will tell you that instruction before you start. We're nearly there. Promise. Last 2 slides. PFR. I hope you're enjoying, guys. You're still awake. If you're in the Philippines, I know it's 2 o'clock in the morning. Thank you for staying. I don't know what time is it now in the Middle East. In Nigeria, it's just, we are 1 hour. You're only 1 hour behind, right? So PFR. Second to the last, third to the last slide. Incorrect and incomplete instruction. So make sure you know your short, sharp, half. Yeah? Don't forget that. Your short, sharp, half. And of course, make sure the patient is sitting upright and do not impede the needle gauge. Of course, you need to identify the normal value. Before you start, you need to identify what is the expected normal value for your patient. I hope by now, if you're doing your examination very soon, you know how to identify the normal value, right? You need to check for the height. What else? The age of the patient, and of course, the sex or the gender of the patient. Yeah? You need to get familiarized with the documents for the PFR. And of course, wrong interpretation. So remember, you will be asked to do 3 readings and you have to select the best reading out of 3. Okay? Normally on the examination, it's just 3 readings. Again, the highest reading is the best reading out of 3. Okay? And you have to explain what is the finding. Is it within the normal range or do you need to do something else with that result? Okay? And of course, last but not the least is our aim, incorrect and incomplete instruction. Remember on the exam for the aim, there is option. If the patient cannot hold their breath for more than 5 seconds, you can tell the patient to take 5 normal breathing for 5 cycles. And if they can hold their breath for more than 5 seconds, they can do a single breath technique. Yeah? You don't need to teach all 2 techniques. You only need to teach 1. So at the beginning of your aim, you have to have the conversation. Let's say patient Emer, we have 2 techniques on your administration of inhaled medication. Are you able to hold your breathing for longer than 5 seconds? If so, we can do a single breath technique. If not, we can just do the 5 regular breathing, 5 cycles. Yeah, so make sure to have that conversation so the patient could choose which one they prefer. Okay, you don't need to teach both, just pick one. And of course, you have to check if the prescription is correct, complete, and due your time. Yeah, check the expiration date. And of course, make sure to administer the correct number of puff. Normally, an inhaler contains 100 micrograms. Yeah, salbutamol inhaler contains per puff 100 micrograms. If you're asked to do 200 micrograms, how many puff are giving? Of course, 2. That is obvious. Basic math, yeah? That is it. I think we are done for tonight.